Today we're going to be talking about evidence-based feedback strategies and clinical supervision. We here at Iowa are planning to turn these supervision talks into a webinar series. So we just want everyone to know to be on the lookout for future events. We're hoping to provide offerings in both the fall and spring. Today's talk will give you 1 hour of CEUs, and we'll be sending a certificate of completion via the chat at the end of the talk. Please keep that, as your CEUs will not be automatically submitted to ASHA. And we already have had some questions about watching as a group. If you're doing that, all members can count this towards their CEUs as compliant with ASHA's Code of Ethics. We will also be sending handouts via the chat. And if you would like to access this talk in the future or look for additional video resources, we have shared our YouTube link here. Our goals for today are going to be to discuss a theoretical framework for thinking about supervision. So we'll talk about Anderson's continuum of supervision. We're going to discuss a variety of evidence-based feedback strategies in the supervisory process, including examples. And then we're going to spend some time applying those strategies to clinical supervision experiences, both all of your professional experiences, and then we have some case studies if time allows. So before we get into things, the three of us presenters are going to introduce ourselves. My name is Jenny Brodell. I'm a clinical assistant professor here at the University of Iowa. I also have a dual role at the University Hospital here. I specialize in autism and pediatric speech and language, and I have had former experience in an outpatient setting.
Hi, I'm Louise Pinkerton. I also am faculty here, clinical faculty at the University of Iowa. My specialty is in voice and upper airway disorders, also performance voice related to rehabilitation of singers and other performers. I've experienced as a professional singer and then acute inpatient rehab hospital and outpatient settings, primarily with adults.
Hello, everyone, and my name is Stacy Robinson. I also specialize in pediatric speech and language, similar to Jenny, and I have former positions in outpatient settings as well as the school setting, and I am also a clinical faculty member here at the university.
So first, I'm going to talk through Anderson's continuum of supervision, which is a framework that can be helpful in conceptualizing the partnership between a clinician in training and a supervisor, how that changes over time, specifically with feedback in mind, since that's going to be the main topic today. So this is a conceptual framework, Anderson's continuum of supervision, that we think about a lot here at Iowa. So we just wanted to do a brief overview to get us on the same page in terms of thinking about the supervisory process. Under this model, supervision runs along a continuum in which both the learner and supervisor change. So the supervisor gradually decreases the direct amount of supervision as the student increases competency and self-motivated learning. And then really your supervisory style and the strategies you're using change given the needs of the student, the expectations that you as the supervisor have and the supervisee has, and the variables of a given clinical situation. So with this model, there's 3 stages to consider. The first being the evaluation feedback stage, in which the learner needs more consistent, direct feedback from the supervisor. There's a middle transitional stage in which the student gains more independence, and so less consistent and direct feedback is needed, and the partnership becomes more collaborative in nature, with the student and supervisor sharing ideas. And finally, the self-supervision stage, in which the student has gained independence in the relationship, and the supervisor is more consultative in nature. And so really, the student is reflecting independently, they're self-motivated to continue learning, and they're sort of coming up with feedback for themselves. It's important to note that stages aren't necessarily time bound. A student could be anywhere on the continuum based on their prior knowledge, skills, and experience, and then again, given the variables of a situation. So you might have a student who demonstrates more independence on day one with a specific type of client. And in those situations, maybe you're acting more as a consultant with them, where your feedback is minimal, indirect, and heavily reliant on the student's reflection and motivation. However, with maybe another client type, the student might need more collaboration or even direct supervision, where you're having to provide lots of feedback. So when we're thinking about the feedback we need to provide, it's really up to us to work with students to consider where they are on this continuum given the situation. So now that we have that foundation for thinking about the supervisory process and how general amount or type of feedback might change over time, we're going to talk more about strategies for providing effective feedback. Many learning theories discuss the significance of providing feedback, specifically as it relates to changing a person's performance. Thus, in the supervisory process, providing feedback is going to be essential in shaping independent clinicians. This next chunk of information we're going to go over regarding feedback is from a paper by Laura Mogensen and Markins, which is going to be in the handout that's linked in the chat. So to start any supervisory relationship or a setting in which a person will be receiving feedback, it's really important to create an accepting, positive learning environment. Feedback should really be an anticipated or expected part of that learning process. So that means explicitly talking with the student about the importance of feedback, um, and talking about the logistics of that. So where, when, and how will they be receiving feedback? It's also important to get input from the student to create a sense of ownership. So asking questions like, do you prefer verbal or written feedback? Do you like to debrief and discuss immediately after a session, or do you like to have time to reflect on that and then talk a little later on? Obviously, especially given the setting you're in, you can't accommodate every single request, but we want to recognize that each student will require unique support and then value that and prioritize it as much as we can. So one idea is just, even when you're having your onboarding meeting with students, to make sure you're being explicit about the fact that feedback is part of the process, and here's why we're providing feedback. It's for your learning, and then getting the students feedback on how they prefer to get feedback. Setting up an accepting environment also involves helping students to recognize that part of the learning process is making mistakes. We want to reassure that we as supervisors are there to support them and help them learn, and that making mistakes is a typical occurrence in that process. We don't expect any student to know it all, or any practicing clinician for that matter. So we want students to recognize that the learning process is going to be continuous, that it's okay not to know something, and that their practice and gathering of resources is an essential component of the learning process. So essentially, we want feedback to be viewed as educational rather than punitive. Helping them learn and think critically about what they're doing is our main goal, so that then eventually they can independently recognize and know how to implement changes or continue things that they're doing. Something I always tell students at the beginning of a semester is, that it would be really weird if they started with me on day one and they never needed any feedback of any kind. Then they wouldn't need to be at their outplacements or, doing this clinical practice that we engage in. And and having a full page of feedback from a session doesn't mean they failed the session, just means I was thinking a lot about what was going on, and I'm trying to point out different aspects of what was happening in the session to the student. Another component in creating an accepting environment is building rapport and thinking about how you address individuals when providing feedback. So trying to use a non-judgmental speaking tone while focusing on the task rather than the individual. And that leads into the next consideration for feedback I'm going to discuss. So when providing feedback, it's beneficial to describe what you observed the learner do rather than the overall quality or value of the student, because that can reduce receptiveness to feedback. So for example, saying something like, the visual supports you used in this activity seem to support the child in doing XYZ rather than you effectively supported the child, because there were not really being specific as to the behavior that led to that change or that outcome. We're just assigning value to the student. Um, when we focus on behaviors, that provides information on specific actions that a student can continue or change over time. And just a note here, that part of the feedback process is to provide input on positive things too. So things we want student clinicians to continue doing in addition to just corrective feedback. We also want to only focus on behaviors that can be changed, because again, we don't want to demoralize the student or focus just on the individual rather than the behaviors that we're seeing. Um, and a final consideration that I'm going to discuss is to think about how you frame negative or corrective feedback, and specifically considering using I statements when doing so. That presents feedback in terms of your perception of a behavior and seeks to avoid that feedback is being perceived as a judgment of student worth. It also makes it more difficult for a student to deny the feedback you're giving because you're speaking from your own perspective, which again allows the focus to be more so on a specific behavior and why that might have led to your perspective, and then how that behavior could be modified in the future. So for example, I noticed the client didn't engage with the task when visual supports weren't used versus you didn't provide enough support to help the client be successful.
All right, so I'm going to take over here and talk about the next few strategies. So the first one I want to cover is about specificity. And this one really flows well from what Jenny was just talking about, of focusing on behaviors rather than the individual. Because if you're trying to give feedback about a specific behavior, that's going to lead to more specificity. I can be a lot more specific when I'm discussing an action or an event that happened in the session, such as kind of what Jenny was just saying. I noted that the client did this when this happened, versus if we're trying to talk about an individual's overall qualities, that is going to be less specific usually. Specific feedback also leads to really clear communication between the supervisor and supervisee. I personally provide a lot of written feedback. Part of that's preference and part of that is just logistically, that's usually easier in our setting. And so I find that trying to be very clear in my written feedback is really important. So, and I do this usually by including rationale and examples. So if I'm asking a student to change something, I usually want to include why I'm asking them to change it. One, this kind of holds me accountable to making sure that I'm asking for a change that, kind of like Jenny was saying, can be made. And also a change that is based on evidence-based practices and strategies, not just always based on my personal preference. And I also will include a lot of examples. So as an example, if I'm talking about direct verbal feedback, if I'm kind of trying to shape that in students, if they are using direct verbal feedback that I think is effective, then I will usually write out exactly what they said in my written feedback. So it gives them an example of, oh, when you said this, I consider that to be an effective example. Versus if I'm asking them to change it, I might say, instead of saying whatever they're saying, I would probably say it more like this, and then give them an example of how to fix it. And supervisees do generally prefer this more specific feedback over vague feedback, which is intuitive because if we're thinking about it, we were all once supervisees and graduate students. And if a supervisor gave us fairly vague information, we didn't always know how to adapt our performance based on that. So on the next slide, I have a few examples. of non-specific versus specific feedback. I do want to note that at some points, non-specific feedback may be appropriate. So kind of in that last example, saying like nice work on the progress note, if I've been editing and giving a lot of specific feedback on written communication all semester, probably by the end of the semester, I could say to the student, hey, you did a really nice job on this progress note. And they know what I mean because I've said more specific things earlier on, like your documentation was concise and it covered all the main points of your session, such as, and give them, again, examples of what that looks like. I find that, saying things like great job today might work well, right after a session if you don't have time for verbal debrief, but hopefully you'd have written feedback or a later meeting where you could say things more like, I noted your client was engaged when you, and then give the example of what the student or supervisee did that in that moment. Or I noted that you administered this evaluation tool appropriately by, and then list the things that they did that were indicative of appropriate administration. This also applies to critical feedback. So instead of saying something like, oh, this task didn't really work, you could say this task wasn't really accomplishing our goals because, and then provide a rationale. I find this to be really important, especially at the beginning of a supervisory relationship, because this gives students a peek into your own clinical thinking process and your own critical thinking skills. And that gives them a model for later being able to think through those things themselves, because Louise especially will talk later about, we eventually want to get to the point where the student is starting to give themselves feedback rather than us give them feedback. But the way to help them model that is to give really good feedback at the start. I know specificity can be pretty difficult sometimes. And so these are just a few tips from my own experience. So one is to take notes in the moment. I take a lot of written feedback. So I'm always taking notes in the moment, and that's usually the feedback my students are seeing. But if you prefer verbal feedback, or for your supervisee prefers verbal feedback, I would still recommend, during treatment sessions or during evaluations, try to take some notes on what you're seeing to help with your recall. I find this to be the most difficult if we are doing evaluations or if we're seeing a new treatment client and I'm more involved in the session. So maybe my notes aren't as extensive, but just when I have a moment, we're all used to trying to take data during our sessions. Taking notes about supervisee is kind of the same as taking notes about your client. Sometimes I'm just doing both at the same time. In my written feedback, I also outline my comments by the activity or the task that we're doing. So I have a table and a shared document that my students can see right after their sessions. And I just have every row is a different activity. And then I have a column for positive feedback and a column for suggestions. And that just kind of gives them a frame of reference. That way I can say some more general things like, your prompting hierarchy was really effective here. And they know at least what activity I was talking about or what goal we were working on in the moment. For paperwork feedback, I find track changes and comments in Word to be very helpful. Track changes really allow you to show what specific things are being modified in the moment. If it's something that you find would be difficult to actually explain to the student how to change, sometimes it's easier to just model for them how to change it. And then comments really allow you to speak freely and give more feedback that way. And then this last point kind of goes into our next point, is that you can use goals and standards to help frame your thinking. So if you're having trouble thinking of specific things to comment on, referencing the universal goals and standards that we have can be helpful. So that is our next tip, is to compare students to a standard. So ASHA has specific standards for SLPs and audiologists that are going to be certified. And I have the link to those standards here. Clinical fellows in speech pathology also have a skills summary to, again, give them a standard. I think the most important thing to point out in this area is to review these at the start of your supervisory relationship. So if you're working with graduate students, especially if you're in an externship or an outplacement supervisor, The students are going to be familiar with these standards, but I think being familiar with how you are going to look at these standards is really important. So for example, when I'm talking to students about our CASA standards, I always talk about what Jenny was talking about at the beginning, the continuum of supervision, because when I am giving feedback according to standards, it's almost always based on the level of supervision that I have provided. So I always tell my students, we are providing specific and effective care to these clients at all times. What changes is how much support I am providing in the moment. And so when you see my judgment of these standards, it is based on how independent you have been in meeting these standards, not necessarily the quality of work that you're doing. Because I should, as your supervisor, should be buffering any quality issues that we are seeing. Most university settings will already be set up to regularly meet to discuss reviewing standards. Also, the CF skills summary should be reviewed every quarter. But we here at the university, we also try to do quarterly check-ins. So not just at mid-semester and end semester, but every 4 weeks, we'll try to do at least kind of a more informal check-in with our students, just to let them know how things are going. We don't go through every single standard, but we at least give them a little bit of information about how they're doing, and we can highlight some strengths and areas for improvement. And then you can reference these standards in daily or weekly feedback. I wouldn't specifically say, according to CASA standard 2B, you should be doing this. But if CASA standard 2B is implementing treatment plans, well, then that helps me frame my thinking for how to provide feedback in the moment. In addition to these universal standards, you can also set individual goals for your students. This is something that I tend to do more so at mid-semester. I find that my supervisees are more ready for that about mid-semester. Usually the first half of the semester, they're getting used to their clients, they're getting used to our supervisory relationship. And usually by mid-semester, they're independent enough that they can come up with some of their own ideas for things that they need to be working on. But goals can be created at any point. If you're working with a more advanced supervisee, maybe you talk to them about goals right at the beginning of the process. Maybe there's 2 weeks left and they're starting to get really independent and you really want to push them for those last 2 weeks. These are things where you can kind of take the supervisee aside and say, okay, you're doing really well. Here are some things to work on. Or for supervisees that are struggling, setting up individual goals can really help them know where they need to hone in and focus their time. And these goals can be updated or changed as supervisees progress. Our last thing to talk about today is timeliness. And I've actually seen already some questions come up about that in the chat. Timeliness for feedback is really dependent on the content and logistics and the supervisee. So some feedback has to be provided in the moment. For example, if a student is administering a standardized evaluation and they are operating outside of the bounds of standardization, you have to fix that in the moment or your evaluation is not going to be valid. If the student is doing something that is really unsupportive of the client in the moment, you have to go fix that. Some supervisors also just prefer to be a little bit more hands-on, and that is definitely valid as well. Other things can wait until immediately after the session. You know, maybe it's about how an activity went or how a specific prompting hierarchy was working. Those things can usually be saved for immediately after, especially if it's something that, you know, if I were in the session myself, maybe I would be making a few little tweaks, but for the most part, it would be working. I would usually save any of those tweak comments till afterwards. During our weekly or bi-weekly meetings, I usually talk more. I give a lot of planning feedback then because we're usually planning for the next session. And then also if I'm noticing any patterns, like if the student is for the last few weeks has been consistently struggling to provide specific feedback, for example, that's maybe something that I would bring up in a meeting where we have a little bit more time to talk. They're not just trying to process what happened in a specific session, or kind of more removed from that. And then probably my most pattern-based or generalized feedback comes at those mid and end placement evaluations where I'm really noting like overall strengths and needs. Your setting or your space might also limit when you're able to provide feedback. So we're in an outpatient clinic setting. I see pediatric clients. So from 2:30 to 5, pretty much every day, I am seeing multiple clients back to back, sometimes overlapping because we have students. And so I don't always have the ability to give verbal debrief right away. This is part of why I rely a lot on written feedback so that students do have some immediate something that they could read. But you might be in another similar situation where you can't give that verbal debrief every time. If I have students that really want a verbal debrief, I can offer, maybe a couple of sentences, and then we're going to have to just move to written feedback, or we can set up a time later in the day when I have a moment where we can talk about how things have been going. Space might also limit you depending on, if there's a private place where you guys can give feedback. And then finally, the supervisees' preferences and readiness will also play into this. Some supervisees will have preferences of what kind of feedback they get and when. Some want to talk right away. Some need that time to process. And then sometimes, and Louise will talk about this also, but if we are working—
How are you?
Could everyone make sure their devices are muted? Thank you. And then finally, if the supervisees are starting to work on giving their own feedback or really building their self-reflection skills, maybe you would delay your own feedback to give students that independence in that area. That pretty much wraps up everything I'm going to discuss. And now Louise is going to come talk about our next point.
And as you've noticed, a lot of the points overlap and interplay quite well. And I think the appropriate amount of feedback fits really well with that idea of being timely. Because you don't always have time to provide a lot of information, and that may actually be a good thing. When you're giving the appropriate amount, what we need is what the student needs right at that moment. What with their cognitive load can they take in? If they've just finished a session, they're about to go right into the next session, you don't need to give a lot. Maybe just the high points, or maybe some things emotionally to bring the student down or get them in the right frame of mind to go on to the next session. So if you give too much information, if you're talking too many steps ahead of what's to come, you really can overwhelm the student. So we balance all the other aspects with, again, what's the appropriate amount right at this moment. Some of the things that are important to consider in selecting what you want to share is what a couple of the learning targets might be. And on my next slide, I'll talk about some examples of that. But you really want to think about what are the essential things in the session that I want to comment about. There's always more that you could say, but how nitty gritty do you want to get detailed? How much do you want to talk in general terms about broad ideas about being a clinician? Figuring out, again, what are those essential core skills that we want the student clinician to leave our placement with? And that comes into also the idea of small amounts. It balances a cognitive load issue. It can help with time issue. It can help with, again, just identifying a couple of those targets. And if we want to give it frequently, that fits well with providing feedback in a lot of different formats. So again, some right away, some written, some in a meeting, some immediate, some delayed. And if we go to the next slide, I have some specific examples thinking about learning targets. Again, choose just 1 to 3 things to address. I mean, that's a lot to walk away from a feedback session and keep in mind and make concrete changes from. This is a great time to connect that to the standard and learning objectives. Again, what are the things that are most important for the student to gain or learn? Sometimes it's going to be hands-on, did they do the therapeutic activity correct? Sometimes it's going to be those broader ideas about being a clinician and interacting. And even if there are problems with both or feedback you want to provide on both, which one fits most at that moment? And one of the criteria I use when trying to decide what to comment on is things that address metacognition. So things, concerns, activities, critical thinking processes that bring conscious attention to what strategies we're using for thinking about things, learning, or problem solving. On the voice team, one of the things I think is very important is that people have a really good mental model of how the vocal folds vibrate and function, And then how did the disorders affect that? Well, students, even after taking voice disorders, are not going to have that. So we definitely spend time in feedback with, okay, here's what the problem is with the vocal folds. We know there's nodules. Here's what we're hearing from the client. Tell me, let's break down, let's talk through what's happening on the vocal fold level, what's happening mechanically and physiologically and acoustically, so that you can then think about that as you're doing therapy. So we really break down that thinking process and problem-solving process and how it fits in with this complex situation with anatomy and physiology. Again, the students wouldn't be able to do that on their own, so it's a great opportunity for us to go through, again, that metacognition of how you start to do that so they can become independent. And the next point is about self-directed learning, and this fits perfectly into that continuum at the beginning. Gradually, we want to move the students from strong reliance on their supervisor to independence. And where you are in the experience spectrum is going to matter. The students we get are going to start at the beginning where they're very reliant on us. But hopefully by the time they're done with our coursework and clinical work, they're going to come to you for an externship or a CF further along that continuum and ready to take more ownership and responsibility for their learning. So that ownership that we get by discussing goals and planning from the beginning is very important. And people aren't going to learn and hang on to things if they don't have a personal stake in it. So you want them to share what their goals are and also make sure they know what your goals are so they can take ownership of their progress and really be making those steps and taking charge of it. As we move to the later stages, I definitely encourage self-reflection first. I mean, those students that want immediate feedback, I provide immediate provitive and supportive feedback. But for the critical thinking part, I really want them to be doing that. And on my next slide, I'll give some more ideas for that. Again, I get it from them first, and then we can talk about it together. Also thinking about their critical thinking process. And I find that sometimes people are right with me with what they're thinking. Sometimes they're off somewhere different, so it's a great opportunity to discuss it. And sometimes they bring up things I hadn't considered. And I think that's really important as supervisors, is because we can get very honed into these are the things I want the student to learn, or these are the things that I always watch for, and there's other stuff we might miss. And so having the student bring that forward can be very valuable. And then with the self-directed learning, again, coming back to those student goals. What does the student want to get out of the experience? How does that align with the broader learning objectives, the learning objectives for the facility, your learning objectives for what you want people to develop? And, I think it's very important because sometimes for us, we get people, not everybody on voice team is really excited about doing voice and upper airway disorders. So even if maybe the student goal isn't that I want to be a fabulous voice clinician, what can we have as a goal that helps them reach their goals to do neurological therapy or pediatric therapy or work in a school? So how can my experiences support their broader goals? So let's talk a little bit more about self-reflection. One of the things I do about midway in the semester with my students is I start them giving me a self-reflection email after their sessions. Often I start with the idea of, what are 3 things you did well? Why is that important? What are 3 things you would change? How would you change them? The goal here is to get the student to start with the things they did positively before they delve into the things they were dissatisfied with, and also to really think about what's the importance or the value of doing this well. A lot of people would be like, well, I had good rapport. Okay, that's great. That's a very important thing. But again, why is that valuable? Why is that important? Why did it make a difference in this session? Now, obviously, if you're in an externship setting or a CF setting, you're not going to want these after every session, and the student's not going to be able to do that. So it might be that maybe they do a self-reflection email once a day, they do it once a week. I definitely rotate the questions that we work with. Sometimes they're student generated. These are the ones I generate. And I also at some point try and put some things in again about how the student is managing themselves. So what were their own emotional states? How were they feeling as they went through the session? And what are the tools and things they did to make sure they stayed focused on the client? So it's not, whoops, I'm messing this up, but okay, I made a mistake. How am I going to turn this to be about supporting the client and moving forward there? And again, I provide feedback afterwards. I want to know what they think. So again, I can support that they're doing good critical thinking like we want. I can move them in a different direction to consider other things, or we can consider things that hadn't been on my plate to consider. We have one more idea here specific with feedback, and that goes to requesting feedback. The students are not the only people that are learners. We need to continue to learn as supervisors about the process, about working with the individual we're with, about sharing new skills we've learned as a clinician with students. So we're a never-ending project as clinicians, and it's a never-ending project of improving your skills as a supervisor. This is reliant on that open and honest communication environment that we want to set up from the beginning. You know, if people don't feel safe talking to you, they're not going to give you honest and open feedback, which is what we need. So really building that relationship and rapport in the beginning makes it so you can get good feedback. And again, my second slide will be some more specific ideas here. One of the great things you can do with requesting feedback is you can also model receiving feedback. This can be a new thing for students we work with, and many times run into defensive issues or needing to justify and explain everything. And just the idea that you can hear something and go, okay, I heard that. Or, okay, I hear what you're saying, let's discuss it because I have different ideas to bring to it. And again, whether you agree with it or not, whether it's based in what we know works for working with students or not, you can still accept it and acknowledge that that's the idea that the student is bringing forward and that we need to consider it and discuss it further. And certainly requesting feedback doesn't mean you do everything the student asks for. The students don't know what they need to know in all situations. So it's okay to justify and explain that I appreciate your feedback and that that's your point of view. We're still going to do it this way because of these reasons. And let's go to the next slide. So some of the things you can do, again, with specifically requesting, and I think I see some things going up in the chat, so thanks to people for providing their ideas as well, is, you know, just talk to the students about how they feel when they get feedback from you. Are they receiving it the way you intended? Are they able to take that information, remove it from whatever their emotional response might be to it, and really hear what you're saying? Do they have suggestions for how you could present it better? Again, sometimes we get in habits of saying things that works for one set of students, but really for another set of people, phrasing it differently could make a great difference, or providing it in a different format could provide a really big difference in how people can comprehend it. I like to do surveys. You know, we at the university have to do them at the end of every semester, but I also do a mid-semester check-in. I do them anonymously through Qualtrics, which is a survey software. Obviously, if you're working with one person, it's not going to be anonymous. Other people do like to do it where students are identified and connected to their responses, because then you can directly go to that student and be like, okay, here's your feedback to me, here's what we're going to do about it. And again, it varies, because sometimes what you're going to be saying is, I appreciate your feedback, that's not something we can do in this situation because of these reasons. I also do regular check-ins. You know, is what we're doing on the team working for you? Are there things you would change? You know, it's not directly providing feedback on my feedback, but providing feedback on how things are working with the students. If I don't feel like I've explained something well, or, you know, you get that face like the student didn't get it, how could I make this clearer? So they can start telling me back what they got, and we can provide further discussion to clarify it. And I often end supervision sessions with the statement, what else do you need from me? Sometimes the answer is no, which feels, or nothing, which feels great, because it's like they feel ready to go into that next session. Sometimes they'll bring up something completely unrelated that isn't important, but hadn't come up. So it gives them a great opportunity to jump in, or to be like, you know, we went by this really fast, but I still don't get it. So that's been very useful to me.